Good afternoon. Welcome to the daily briefing here at St. Clair County EMA office, where we bring you the up-to-date information on the COVID-19. Joined here with Chairman Mark Kern and Sam Bierman from the Health Department. Sam, numbers today.
Numbers today.
I look forward every day to hearing from you.
I don't know that everyone shares that same sentiment, but thank you. I appreciate it. As of today, 33,933 St. Clair County residents have been tested, and that is an increase of 482 from yesterday. We are currently at 3,708 positive test results, which is an increase of 49 from yesterday, and that does include both males and females from under the age of 10 up to their 70s. And today for St. Clair County, our positivity rate is 10.2%. We are at 30,285 negative test results. And unfortunately, we are announcing an additional death today, which does bring our total for St. Clair County to 152. That individual was a female in her 70s who had unknown health conditions. And as always, our sympathies go out to those families who have lost loved ones to COVID-19. For those who have completed their IDPH required 14-day quarantine period, we are at 2,652. For state totals, 2,649,786 have been tested, with 176,896 positive test results, which is an increase of 1,772 from yesterday. For deaths, the state is reporting 7,478, which is an increase of 18 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, currently 41 patients are admitted due to COVID-related reasons, and none of those patients are on ventilators. So that's always a great number for us to be able to report. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, I'm happy to announce we have no new updates from today, or for today. So our numbers are looking good in those long-term care facilities, which is something we continue to worry about. So we're always happy to report that we have no new additions to those cases. Now I will turn it over to Chairman Kern for his update.
Great. Thanks, Sam. And once again today, about 50% of the new COVID positives are people under 40.
It is, yes.
You're going to have to start talking to your peers.
I know. Sometimes you can talk all day long, but when it falls on deaf ears, we can say anything and it's not going to sink in.
Wash your hands.
Wear your mask. Socially distance yourself.
Watch your distance.
Yep, exactly.
Great. Thank you, Sam. We'll move into the zip code reports at this time. Remember, these are COVID positives that are in St. Clair County in these particular zip codes. If you don't hear your zip code, it only means that you just aren't above 5 in your zip code yet. In 62059, the number remains at 9. In 62201, we go up by 3 to 177. 62203, we go up by 3 to 151. 62204, we go up by 1 to 109. 62205, we go up by 4 today to 145. 62206, we go up by 3 to 332. 62207 goes up by 2 to 198. 62208 goes up by 6 to 235. 62220 goes up by 5 today to 292. 62221 goes up by 6 to 321. 62223 goes up by 7 to 160. 62225 remained the same today at 16, and 62226 went up by 10 to 386. In 62232, we go up by 3 today to 80. 62239 goes up by 4 to 41. 62240 remains the same at 14. 62243 goes up by 2 to 26. 62254 also rises by 2 to 116, and 62255 remains static at 12. 62257 goes up by 1 to 20. 62258 also goes up by 1 to 54, and 62260 also rises by 1 to 40. 62264 stays the same at 65. 62269 goes up by 12 today to 250, and 62285 goes up by 1 to 32. All week we've been talking with our schools, and Susan Sarfaty's been kind enough to put our schedule together for us. Today we welcome Jeff Dougherty to the program. He's the director of Bevel Area Special Education Cooperative. Welcome.
Thank you. I appreciate it.
Now we appreciate you being here. So, have you got your plan put together, I assume?
We do.
When does school start?
Our programs are operated in various locations. So we start in our earliest site on August 10th.
Okay.
Our latest starting site is August 20th.
So what are you going to do on August 10th? Let's hear about it.
Yep. We're right now going to be a pretty traditional approach to things, a shortened school day, just like many districts in our area. We are going with a 5-hour instructional day. A lot of different cleaning procedures that are new, as I'm sure everybody in the area has heard about. Our programs are a bit different than traditional programs in that we work with some of the most exceptional and complex kids in the area. So oftentimes our students need a lot of hands-on things from us. So we work very closely with them in a lot of different types of services. So spacing is a big deal in our classrooms because it's not something we're accustomed to doing. So this particular site that opens on August 10th is actually a site for part of our autism program. So those students typically deal with a lot of sensory issues, a lot of communication challenges, and we're prepared for those. We know those students, we know their needs, and so it's a matter of just making sure that students and staff and all of us stay as safe as we can while we're doing what we do.
And so I understand you've got a new facility this year, or at least you're
Correct.
moving into the old Bell Valley North facility, which
That is
is
correct.
that should provide you a lot of opportunity, a lot of area to work with.
It will. It will. Yeah, we're very happy to soon be purchasing the old Bell Valley North Elementary. That's part of a different program that I was talking about before. That's part of our Pathways program, which is devoted to students with emotional and behavioral challenges. So it's a big growing program of ours. It's been growing consistently for years now. So we ran into issues with space on our main campus and looked for other alternatives. And that building being already set up as a school, at one time in this area, a very prominent school, we're glad to be part of it again.
A lot of great graduates from there.
This is true. Yep, no, it's great space for us. It's gonna give the Pathways program 20 years of growth ahead of us without having to worry about space challenges. So we're excited about that.
So beyond COVID, that's
Correct.
going to be a successful place.
Correct.
So let's talk about masks. Everyone's going to be wearing a mask. You have some special needs situations, so will there be masks that are transparent?
Correct. Yeah, there will be masks on everybody unless there's a medical exception in place. It is very possible, in particular in one of our programs, for us to have some students that medically are not able to have a mask on due to breathing difficulties. But in a broad sense, most of our kids are going to be wearing traditional masks, just like you and I have, in our pockets or in front of us. Some of our students who deal with hearing impairments every day, however, there's other alternatives that we're going to look to for that. Given that face shields aren't quite as safe as a traditional mask, our deaf and hard of hearing and audiology department are currently trialing different types of clear face masks to allow students to be able to see lip movement and things of that nature. So
Great.
there will be a variety of things.
Is your school day going to be the same length as it normally is or normally has been in the past?
It is not. We are shortening to a 5-hour instructional day.
So what time will that start? And just so parents know,
Yeah.
and they probably already know. But
Yep. Yeah, there's been communication from us to all of our families, but that depends on the particular site. So, but in general, our sites are going to be an 8:30 a.m. to 1:30 p.m. type of attendance day.
But
yes.
that
Yep.
changes. So you were talking about the parents. The parents had input on your program. Did you do a survey and found
Correct.
what they would like to see?
Yes, we've talked with our families a lot since the initial closure back in the spring, trying to refine what we were doing then, what works for our kids, what doesn't, preparing for this upcoming school year, knowing the pandemic isn't going anywhere for a while. We've been in a lot of contact with families, yes.
So last spring, you were completely shut down for a while, I would assume.
We were, just like all the other districts, yes.
And then were you able to open up a little bit by the end of the year, or you just were closed?
We were not. No, we stayed in closure status through the summer term.
And now your staff has been able to work on programming some sort of remote learning. So is this going to be a hybrid situation, or are you hoping that everyone will be attending?
It is not a hybrid situation. We do have some students, some families that have elected for students to be in remote status. We'll continue to maintain services for them, but our in-person model is all in-person every day. It's not an alternating schedule. We're prepared to grant remote for students and families that feel it's necessary, but that's going to be a smaller percentage for us than it is for a lot of our local districts.
So how about food service? I'm sure there's been thought given to that.
Oh yeah, yep. Food service and sanitation and all the things that everybody else is talking about.
So
yeah.
you will be providing meals at school?
Correct. Some of the things that we're doing are a little more cautious than you would find maybe in traditional programs. Most, if not all, of our students are going to be eating lunch in their classroom. We're not going to be using cafeterias. We're not going to be passing through hallways only in emergency circumstances. We're really going to limit our students' traffic throughout the building and try to time that with other classrooms that are in there. But yeah, all those things I feel we've thought of everything we know to at this point.
And class sizes, have you adjusted class sizes to meet with the square footage that you have to work with, so the kids will be distanced?
We have not actually had to adjust class sizes. Based on the fact that we operate special education programs, our classes are already smaller. So unlike a traditional classroom where you'd find 25 or 30 students possibly, you walk into one of our classrooms, you're going to have 8 or 10 students, just by design. So that helps us out quite a bit with regard to some of these requirements. Most of our classrooms are fairly large to begin with, so distancing will be easily achieved for us compared to that of a traditional school.
How about sanitation during the day, or is it will you go between sessions, or will they be just once a day, or at night, or?
That depends on the topic. Certain sanitization tactics will be used multiple times throughout the day in high traffic areas, offices, bathrooms, water fountain refilling stations, things of that nature. Classrooms at minimum daily. Some of it's going to depend on what occurs in that classroom, what type of program it is. So some of our students who are a little bit more medically fragile, or who may have different medical things going on, those rooms are going to be treated a bit differently than those rooms where students are higher functioning. So it really depends on the program a little bit.
So many of the school districts have been able to use CARES Act funding for their programs. Is that something that's been available to you, and have you been able to use those funds?
That is something we've applied for. We believe it's available to us. We've not received it yet, but we're hoping to.
Well, that's
I feel good about it. I'll put it that way.
well, that's good.
Yeah.
It's always good to feel good. What about transportation?
Mm-hmm.
Same. Will it be more spread out than it was? Less people on a bus?
Certainly.
So you'll just be running more buses?
Yep, and there's not a single school department that I feel worse for probably than transportation, because it is it's a major upheaval for them. Some of these requirements, there'll be less kids on every bus. Even buses like ours that tend to be modified, adapted, or sometimes smaller. But yes, that'll be a big change. It's certainly for any transportation vendor going to cause more routes. It's going to cause a lot more stringent inspection and sanitization. And that affects Basque a lot because all of our kids are bused into our programs. So because our programs are operated regionally, the students don't necessarily live in the same neighborhood where they attend for our programs. So transportation is very important.
Is there any point you want to get across to parents that of something that you need their help with throughout this this year, which is probably going to be one of the most difficult that you've had to encounter?
Well, and it's similar, nothing that we necessarily need your help for, but keep your heads up. I know family life is stressful for everybody with a school-age child right now. And for those of you with students in the Basque programs, even more so challenging. Those families, and we know that our students are the ones that you really can't reach very well via remote instruction. So those kids have been lacking resources for quite some time. But I know the circumstances are out of all of our control, but keep your heads up, reach out to us, reach out to your student's case manager for help, regardless of what that help might be, and that's what we're here for. Whether we're in person, whether we're remote, Basket's still here for you, so don't hesitate to use us.
Great. Herb?
A couple questions. The children arriving at school, are they going to have the temperatures taken, or are you allowing the parents to certify that like some of the other districts are doing?
Both. They're going to certify at the family level, and we are doing temperature checks in our locations as well.
Well, good. And you talk about, this is a stressful time for the families and everything. It's just as stressful for the teachers.
Correct.
How is your staff coping with it? I mean, I know they've got to come together, but it's got to be awful challenging for them too.
Extremely challenging. Yes, I think we've learned a lot from the last 4 or 5 months, because being forced into remote instruction during the closure, I think it forced us to think a different way, even when we didn't want to. So we learned a lot about what we can really accomplish, even if we're not in our classrooms. So I think we've gained a little bit of confidence in that regard. But I think just the prospect of looking ahead at this year, knowing that the pandemic is lingering, it's just depressing. It's depressing as an educator because we're not accustomed to that. We're used to knowing our craft. We're used to, even right now, July 30th, most of our teachers are accustomed to already knowing how that first day is going to go. We don't have that luxury this year. So they're very strong people, and I think they've weathered the storm well, but a little bit weary of this pandemic. We're all tired of it. We're all ready for it to go away. And just like I've told the families, persistence is going to prevail. We've got to do what the experts tell us to do, and we'll get through this. It's not going to last forever. We know that for sure.
Well, that's the thing. We keep telling them that there's not a educator out there that wants to put the children in harm's way. They want to be in the classroom with them, but they're going to put the children's safety above everything, and I applaud them all.
Certainly. Your
staff and everybody. Brian, you got a couple more questions come in?
A couple questions came in about a statement you made relating to water fountains. Are
Okay.
water fountains going to be open, or is it going to be a different method in getting drinks or bottled water to the students?
Good question. No, traditional water fountains will not be operating. We've installed water bottle filling stations onto some of our water fountains, so students aren't using a typical water spout.
Okay,
Yeah.
very good. And the other question was, with having the shortened school day, is there any type of latchkey program or supervision available for parents who might not be available that early in the day at the school that's out early?
Through the BASC programs, there is not a latchkey program available. Our families are able to access those resources through their resident district. So all the students that attend our programs live in one of our 23 member districts here in the Belleville area.
So they could go back to their
Their
home
home district of
and
registration.
utilize the. Okay.
Correct. Yeah.
I think that answers what we had.
Okay.
Jeff, we really appreciate you being here today. Very
Thank you for having me.
educational. We've been talking about having you here because it's a subject that really is universal, comes up with every district, and so we appreciate you coming and clarifying, and sounds like you got it ready to go
We are.
on the 10th.
That's right.
Good.
Ready or not, it's going to happen.
Well, thank you all very much. I appreciate
Thank
it.
you.
Thank
Appreciate
you.
it. Chairman, numbers is what we've become accustomed to knowing here, and I know you're working on these numbers. Today, you walked in the door with numbers, and you've been doing it ever since you got here. 49 new cases overnight. Unfortunately, one new death, as we heard Sam report. Some of the questions that we've been fielding today, I think Team St. Clair and others are confused about the daily positivity rate over the region. The one that I watch mostly is the region. That's where we got to stay below that 8%.
Because we are merged with other counties. So
Exactly.
we're Madison, Monroe, Randolph, Clinton, Washington counties. I think those are the ones we're put together with. And so because the state, when they decide what to do in a region, they look at the entire region. It just isn't St. Clair County. But we track our numbers because we want to know how we're doing within the region. We want to make sure that we're driving those numbers downward. That's today we looked at our positivity rates, and our positivity rate for July is less than what it was in June by a small margin. So it's headed in that direction. But man, we got to get the point across. It needs to be going down more. It's still above that level of 8%. We've got to be way below there.
And that's what we're shooting for, and that's what we keep asking Team St. Clair to spread the word. Let your friends, neighbors, your family members, just keep sharing it. Tell them to join in these briefings, and they'll get that up-to-date information.
I got a call from Ruby today. Ruby wanted me to give you her congratulations and tell you that she enjoys this. She watches it, and she's out there promoting. She even has her own page that she shares and promotes things to do to try to stop the spread of COVID. So we appreciate her being part of the
They've
team.
even started Team St. Clair page, and as you know, late at night when I do my unwinding thinking. So I've come to feel like a lot of those Team St. Clair members have become our extended family, because they've all got good ideas. They're asking what can they do to further get this information out there. There's so many people out there that we owe credit. Thanks you, Tammy Kowalski right here. I had a message come in and said we had to give her some data boys because she works every day, and we really appreciate the work that Tammy does. Along with Cindy and Daisy that translates these messages into our Spanish-speaking community. There's just so many of the people out there that helps Team St. Clair. And as you heard Jeff say, we are going to get through this. We just got to keep our head above water. And with everybody's help, we will flip that light switch off here in the future and get back to the new norm, whatever that's going to be. So stay tuned. We'll be back with Daisy in a few moments to translate this into our Spanish community. And then we'll be back here tomorrow afternoon with another update. And everybody, keep your fingers crossed. The numbers will start going in the right direction. Have a good evening.